Trnava University starts teaching counseling, a new study program in the Faculty of Theology. On our premises, we welcomed Dr. Gulnora Hundley from the University of Central Florida, who led a workshop on families and trauma. Dr. Hundley received PhD in counselor education and teaches counseling at the Department of Counselor Education and School Psychology at UCF in Orlando, Florida. She is also a licensed mental health counselor and marriage and family therapist. It's been a pleasure to talk to Dr. Hundley in our podcast Hornopotočná 23, indicating the home address of the oldest Slovakian university dating back to 1635. Dr. Hundley, thank you very much for coming to the Trnava University. So let's speak about counseling. What is it?
Counseling, it's a way to help people, and that is a very generic term and very simplified answer. But generally speaking, counseling process is a way to assist individuals to find their own answer in life. And many people think that counselors give advice and tell people what to do.
Me personally.
No, it's not true. We are there for people to find their own answers and their own way in their life. And sometimes when we struggle, we as people cannot help ourselves. So we need a third party, so to speak, to assist us with that.
So is counseling a technique, a method, or a kind of social work, or what?
Social work is a little bit different. In a sense, like in the United States, there is the whole field of social work, and social work individuals who are part of social work, they are very good at helping people to find resources, to find shelters, to find homes. So, and possibly kind of short-term helping relationships. Counseling, the way I see it, it can be long-term. It's relationship-based. So. Okay. Very well-trained counselors, they know how to relate to other people. They can develop therapeutic relationships.
Can you describe a typical counseling situation?
Counseling situation may depend on a setting and type of services or levels of care. The lowest level of care is outpatient. That means counseling is provided once a week. Then next level could be intense outpatient, or we call it partial hospitalization. That's where clients see counselor maybe 2-3 times a week. And there is an inpatient when a person is in the hospital. Typically it's a crisis, and purpose of hospitalization is stabilization.
I didn't know that counseling somehow relates to hospitals. I'm quite
That's
surprised.
Correct, yes. Okay.
In what way? It's kind of psychology help?
Yes, it's a psychological help. It's a quick stabilization techniques. They provide group counseling. They help individuals to get ready to be discharged from a hospital. So counselors help make sure that person who is discharged have resources. They have psychiatrists if it's needed. They have counselor outside if it's needed. Connections to the pharmacy to get medication. So they set it up. That's the connection.
How does counseling help families today? I indicate your recent workshop at Trnava University.
Oh, okay. Counseling is a big part of family's help because family is a system, and sometimes family do not function very well for different reasons. It could be many, many different reasons. Sometimes, very often, we call it identifying patient as a child. So, and sometimes child's behavior is a reflection of what is happening in the family.
Sure.
So, unfortunately, parents don't realize that, and they bring, let's say, Johnny to counselor and say, we have our child, fix him. And
it happens in Slovakia as well.
Oh, okay. So, and we're like, all right, let's talk about it. And then in the conversation with the entire family, there is a realization that this kid or child is responding to the divorce proceeding, that parents are divorcing and child is reacting because the kid doesn't feel safe when parents are divorcing.
Absolutely.
So
I was just kidding about in Slovakia. We also want our kids to be fixed, usually in church,
course.
in school, or in the psychological ambulance.
I think this is a very important point because if parents bring the child and there is a lack of understanding and that it's about them and not about the child, counselors have to be very careful. You cannot say to the parent, you are a horrible parent. You can't. Because then
it's over.
Then it's over because they will grab the child and say, you are a horrible counselor. And that's it. That means that you are losing opportunity to help the parents. So the way I teach our students, and I do myself, when parents come in and they say, please help my child, and I see it's more connected to the family dynamics, I say to parents, look, I'm going to help this child once a week, but rest of the week, he's with you. How about we are going to be a team? I'm going to help him in session, you're going to help him outside. And let me teach you what to do at home. And I'm teaching them parenting skills. And they don't perceive it as a threat. You know, whenever people are accused in something, it immediately, if somebody tells me I'm a bad parent, I will...
blocks you.
Oh, absolutely. I'm blocked, yeah. So you counselors have to be very diplomatic and find a way how to involve parents. Parents must be involved in child's counseling.
You are a counselor as well.
I'm a mental health counselor and marriage and family therapist.
And so do you work mostly with families? Is that your biggest piece of work?
I work with most of my clients are individuals with trauma, but very often that trauma also related to family. Sometimes I invite partners, spouses. Sometimes I invite family members. So it all very flexible, depends on what's going on. So typically I have identified patient, and I may say this. Whatever you're experiencing can be helped by inviting your parents. Let's do that. Okay. And typically in that moment, it's more about educating parents. For example, they don't know anything about bipolar disorder. And I'm educating parents and I'm explaining to them how individuals with bipolar disorder act, and it's not their fault.
You've mentioned trauma. What kind of trauma can family be facing? You also had a workshop about it at our university.
At the university, I talked about trauma in refugee families, which is kind of appropriate topic because I've heard that there are approximately 400,000 Ukrainian refugees here in Slovakia, it is absolutely nice of Slovakian government and Slovakian people to welcome Ukrainian refugees. Of course, they have different types of trauma, just losing their country, being bombarded, not feeling safe, losing their family members, and being displaced, period. So there are all sorts of things happening, a lot of grief and loss. instability, unpredictability. That is tons of trauma. That is specifically for refugees. And after COVID, there was a lot of trauma. People didn't know how to cope. People didn't know what to expect. People were afraid, would lock themselves, feeling very lonely, absolutely. So when I work in the United States, it could be childhood traumas, could be sexual abuse traumas, it could be spouse abuse, domestic violence traumas. That could be, it's not simple, but I call like a person got into a car accident and they cannot drive anymore. I work with that. But my most work with trauma, it's a long-term childhood trauma, and I have several clients who were adopted and they were in a foster care, and they are still trying to work through that. Because especially kids who are removed from their parents or they lost their parents, and for example, parents, they lost it because both parents were alcoholics, could not take care of the child. For a little child, they don't understand what's going on. It's nice that they are removed. For the child, what did I do? How come my parents left me? And with that thought, they take it into their adulthood and they continuously feel empty. Something is wrong with me, but because my parents left me. So, which is not true. It's kids didn't do anything wrong. Parents were, irresponsible parents. So that work is very hard.
Do you see or recognize some specific, I would say, results of counseling? Do you experience that it works? It helps?
Yes. Interestingly enough, trauma, one of the few things, is actually curable. Mm-hmm. Not just treatable, but curable. Mm-hmm. An example is that the outcome or results looks like, first of all, clients, they become more aware about what's going on. They have more positive thinking patterns. They have more positive beliefs about themselves, because typically any childhood trauma, they develop beliefs, something is wrong with me, it was my fault, I'm not capable, things like that. So as adults, they reevaluate those thoughts and definitely strengthen their self-esteem. And also, instead of having still in adulthood having that childhood thinking, I'm helping them to grow up, and their perspective is different.
We don't have counselors in Slovakia yet, but Trnava University has started that program, and one of the aims is to, I would say, build or to create future counselors in Slovakia. In terms of Florida, where you live, or generally about the United States, how do you know what should you do? Does the state call for you to help in families, or does the hospital ask for a counselor? What's the system, what's the scheme that which family needs your help?
Okay, I specifically my involvement is from private practice. I have private practice, and I do not accept insurance, so clients pay out of pocket. So nothing stands between me and client. It's just that.
So they find you?
They find me, yes. Okay. I have a website, let's say that. So
they know that they need help?
They typically come to me, they know I'm a trauma therapist. Okay. But we have other services that, let's say, agencies, nonprofit agencies that provide services no cost or very low cost, and counselors also provide services there. So there are different levels of help that available in the state, in the city. There are always services that if somebody doesn't have money, like Ukrainian refugees are coming to Orlando as well, to Orlando, Florida. And there are services that are available there that can provide medical help, counseling help, probably food, possibly shelter, things like that. So that is available.
So counseling is a part of your job or part of your own practice?
In my practice, that's what I do.
Okay.
I counsel it.
Okay, it's like
and then
100%.
I have second job. I teach at the university.
If I'm correct, you are a doctor of medicine and a psychiatrist. Am I right? So what was your way to counseling?
Yes. I'm a very unique person, I would say, in America as a counselor, because my original profession was a physician, a psychiatrist, back in Uzbekistan, which at that time was part of Soviet Union. So I earned my medical degree in Tashkent State Medical School, and then I went ahead and earned my PhD in psychiatry in Moscow Institute of Mental Health. However, I always knew that something is missing. All I did, prescribe medication, and that's not fun. It's boring. And I worked in a psychiatric hospital, and I always was looking for something additional, how to talk to patients, how to talk to families. Therapy and counseling did not exist in Soviet Union at that time. Now it's developing, but at that time we didn't have that, and that's what I was looking for, which I found it when I moved to the United States. And I never looked back.
You were looking for a better solution for mental health problems.
However, I'm very blessed that I can look at mental illness from both perspectives, medical and psychosocial. So,
how did you get to cooperate with Trnava University?
Well,
Long story short.
I know. It was a long story, but at the same time, I don't think it was coincidence. It just happened that Professor Maria Schmidova was visiting UCF, our university, University of Central Florida. At that time, I was a director of the Community Counseling and Research Center. So I was giving them a tour. I think she was with the big delegation there from Slovakia, so from university. And I provided a tour. We talked. We've met with other members of the faculty, and Maria looked at me and she says, you need to come and visit. And I said, absolutely. And next year, in 2017, I came to the university and did one-day lecture on family counseling. And then, because I was just curious, I'm like, let me see what's happening there. And after 2017, we continued our conversations, and that's when Dr. Maria Schmidova said that she's interested in establishing a program, and I said, great idea, and I was assisting her a little bit. And here I am, provided several lectures on trauma and families, on techniques in counseling, therapeutic alliance, a little bit lecture on supervision in counseling. And we continue our collaboration. It's just I think it was a click. Do you believe in clicks? It's like you see a person click, and it's going very smoothly. And I am absolutely delighted to help.
One more question about counseling. What are the ethical issues in that topic and how to deal with them? Because if I remember correctly, you also deal with ethical issues, and I think you teach about them as well. So what ethically can happen in counseling situations?
Counseling, that is a great question, and I can talk forever. We have a separate class, so it's a course on ethics, yes. one semester course. Very important, and we teach students from the beginning. So one of the things is that counseling is a very unique profession. It's a profession based on relationships. And, sometimes relationships get wonky or interesting. And professionalism is number one important thing in counseling. And under the umbrella of professionalism is a lot of things. It's include simple things like, dress code, the way you speak. For example, you cannot promise anything to your clients. Whenever counselors say 100%, I promise you, this is going to happen. No, we cannot promise because it's not true. And most importantly, it's not true because it's not up to us. The outcome is up to the client. And some clients are motivated and some clients are not. Another huge ethical taboo in counseling and psychotherapy overall is not having relationship with the client. And we're talking about intimate relationships. So you cannot have sex with your client. Absolutely not. And while laws, let's say in Florida, says that you can have sex after 5 years, I tell students, no. And the reason is, there's an explanation to that, because if you are seeing that client, you know a lot about that client. And some very intimate things, maybe secrets. And if you are getting into intimate relationship with that client, then that could be element of manipulation. So it's almost taking advantage of the client. That is definite no-no. Another ethical important ethical issue is accepting clients as they are. Multiculturalism is huge, because if you, let's say in the United States, we have African American clients, and if you are white or Caucasian, then you have to be able to connect with that person. And it's okay to say, hey, I don't know anything about your culture. Tell me. So teach me about your culture. And you cannot assume anything. You ask questions, you learn about the client, but you never can assume anything, and you definitely do not give advice to clients.
Are students interested in studying counseling? Are they interested? Do you have enough students of counseling?
Yes. In our program, we have 300 students. We are big. So overall, I think a lot of young people, young and not very young, for some people it's a second profession. They're interested in counseling and psychotherapy. It is a very unique profession. It's a very intriguing profession. And sometimes people come to that profession for wrong reason. But the interest is there, absolutely.
I want to ask about your university, because I've never been to Florida. So what does the student life or life look like at the University of Central Florida? I know this question asks for a long answer. And so
I'll try to be brief. Okay, so we are second largest university in the United States. We have approximately 70,000 students. It's
that.
like a small city.
It is.
And parking is difficult. Definitely. And I think we have about approximately 2,000 faculty. So it's a huge university.
It is.
So I cannot speak for all students, and I can speak for our students, and we have a graduate program. We have master's and PhD in counseling. And of course, during the COVID, life was different. Everybody we were online, period. And I think students missed being together. They miss that camaraderie. They miss those talks, and instead of seeing people on Zoom. And I think what is a reminder that our program is famous for offering classes in person. 99% of classes, I think, in person.
So you don't like online teaching?
Well, it's when it's
necessary.
It's necessary. Okay. You have to adjust. So, but I think students were very happy to return last fall to return in person. They were absolutely happy, and of course with cautions, wearing masks at the time. Now we masks are not required, and that life is it's a master's program. Most of them work during the day, and they come in for class in the evening. They are tired. So it's sometimes challenging for me as an instructor to keep them awake, but I do my best. I do my best, yes.
So you are keeping awake
yeah,
students.
I try to entertain them. Each class is 3 hours. And class, typically they take 3 classes, sometimes 4 per week. And that, if you think about, if they have full-time job, families, that's a lot. Yeah, so I love my students. It may sound strange, but I learn from them a lot, and I consider them my teachers, because in my view and my philosophy is whoever I meet, that is my teacher, and I must learn something from them. So, and I have a lot to learn from fabulous people, very dedicated, motivated, and it's just a pleasure to work with them.
I love at the American universities that they create campuses. That's something great, and I think that your university has a great campus as well.
Yes, I love that campus. It's very convenient.
It's a city inside the city.
Yes, and it's if you want to eat, you find a place. If you want to, there is a I love how. Right next to our building, there is a bus stop. I don't know, something about buses. I love that. It's almost, I guess, reminds me my life in Soviet Union. We took buses, trolley buses, trams.
Cars were expensive.
I didn't have a car. So I feel fortunate to have a car now. So it's beautiful. It's very cozy, comfortable. I think students find everything they need on a campus.
That's great. What do you think that makes UFC innovative? UCF.
We are. It's so-called Research One University.
So you focus more on research.
Focus more on research.
Than more on.
And yes, absolutely. And we have a very innovative faculty and student. We continuously involve students in everything we do. Like, for example, in our program. Very innovative is that we have Marriage and Family Institute, which is part of our program. At Marriage and Family Institute provide free of charge counseling for couples. As a matter of fact, for coming into the workshops for couples, they are given some cards like some store cards, I think. So we are giving incentives to come in and take workshops. And also, Marriage and Family Institute has a daycare. So couples can come in,
awesome,
work on their relationship, and children are taken care of. So, because the idea is if couple relationship is strong, that means children are going to be happy So family is going to be functional. That's the idea.
Do your students have a chance to practice? For example, they can train or be trained to be a counselor, for example, at that institute?
Yes, we are, again, a very unique program. On the first floor of our building, we have a community counseling and research center where our students go through the practicum. Mm-hmm. And practicum is the step before they go on internship. Internship is they're getting experience in the community. Okay. We have approximately 85 connections in the community, hospitals, agencies, private practices, so students can go
around Orlando
area. Okay. Yes.
Okay.
But our clinic is a kind of stepstone before they go into internship, and they stay in the clinic for 2 semesters. Mm-hmm. Let's say it's fall and spring. Mm-hmm. And we provide services for couples, individuals, and families, and it's free of charge for the community. Mm-hmm. So
students first, they have theory, then they have practicum, internship, and after masters, they are good to go.
They're good to go. However, first year, 3 semesters, this is all core classes, mm-hmm. just theory classes, yeah. Yes. And 4th semester is practicum, mm-hmm. 5th semester practicum, then 6th, 7th semesters our internship. And the uniqueness is that that is Professor Maria Schmidova, she visited our clinic, mm-hmm. our research center, and it's a lab, so it's a very technologically equipped. You will love it. We have cameras everywhere. Mm-hmm. All sessions are recorded. Supervisors.
So you can provide feedback.
Oh, absolutely. That is the best feedback. You know how all basketball players, football players, they record their play and they watch. Mm-hmm. Same thing we do. I mean, not exactly, but that watching what you did is very helpful. That is one level of feedback. And next level is I'm watching, I'm saying, all right, let's talk about that. Mm-hmm. So there are layers of supervision, and that continuous supervision is helpful and prepare them to their next level is internship. So
you've spent several days here in Slovakia, and as I learned today, that is the second time you've been here. What are your impressions about Slovakia and maybe about Trnava University as well?
Great people, lovely, friendly, which makes me comfortable. Mm-hmm. Very welcoming, which makes me want to, do more and collaborate more. And I think it is very innovative for Trnava University to establish first counseling program in Slovakia.
It is.
That is amazing. And I keep telling Professor Maria Schmidova, in the future, you're going to be in history books as a person who established first program. In my hotel is in downtown, beautiful. Love that European style. I love the trams. That sound like something about that.
That's something you miss in Florida.
And exactly. What is interesting, and I don't know, it's just my observation. I've noticed that, and I don't know if those people are homeless or not. Mm-hmm. It seems like people walk around. They speak English. That's fascinating. When they approach me and speak Slovakian, I'm like, I don't. And he says, do you speak English? I'm like, darn.
So, and now I need to give you something.
I know, yeah. And I think that is amazing. I don't know how it happened, but that was interesting.
Sometimes I read articles about homeless people, and many of them are, educated people, but somehow their personal life or economic life crashed. So,
yeah. That is fascinating.
A reason for that.
Yeah.
Dr. Hundley, thank you very much for a chance to have you here in Trnava.
Oh, it's my pleasure. My pleasure. Thank you very much.
Thanks.
Mm-hmm.